everyone. Thank you for joining us. We're just going to give a couple more minutes so attendees could log on.
All right, Catherine, it seems like the rush is over.
Yes.
I'll just add folks as they come on. But welcome everyone. Catherine is going to be driving today. I'll be in the background doing the tech piece. So fingers crossed.
Thank you so much. Thank you, Janet. Thank you, everyone, for taking the time to meet with us today and all that you do and continue to do to empower communities in need. Before we begin, I'd like to take a couple minutes to go over a few things. We will provide information on where questions can be emailed. This meeting is being recorded and will be emailed to everyone. We ask that you keep your microphones muted to avoid disruption, like my coworkers in the background here, and enter your questions in the chat so we could discuss during questions and answers later in the session. All right, I'll pass it back to you, Janet.
Thank you. Thank you, everyone, and welcome. And thank you for making the time to attend this meeting. I have the distinct pleasure to introduce someone to you who's going to share some information with you. David Radcliffe from the Office of State Treasurer Sean Wooden, who, if you have been paying attention to the amazing initiative that has started as of July 1, is going to talk to you a little bit about baby bonds. So, David.
Thank you, Janet, and thank you all. It's great to be with you this morning. And first, I just really appreciate the work that you all do. In normal times, what you do is really extraordinary. And in these extraordinary times, it's even more so. So just really grateful for what you're doing. And what I'd like to spend a few minutes talking about might help you do even more for the families that we all care about. And as Janet mentioned, the state treasurer proposed and was successful in winning this past legislative session an effort called Connecticut Baby Bonds. And whether or not you've heard about it, I'll just do a quick helicopter version of what it is and what it could mean for Connecticut families. So Connecticut Baby Bonds was inspired by a federal proposal by Senator Booker of New Jersey. And the idea is to invest in families and babies, particularly who come from families with lower incomes. And not just a college savings account, but a really substantial infusion of dollars that this office would invest and grow over time. And when that baby reaches 18, has this account that's grown to a pretty decent sum. And so this proposal was it was actually successful. And so we are the first state in the country to have a baby bonds initiative. And the research has shown us, through Columbia and others, that this could have a significant effect on closing the wealth gap. And by that, I mean, and in your own experience, and maybe families, that there are great differences in wealth that accrue to particularly white families versus those of color. And this sort of investment up front can really help close that gap. And so that was one of the intentions, just to help it spur investment in families and also in our communities. And so what it means for Connecticut is that if you have a baby whose birth is covered by Husky, are born after July 1st of 2021, you are automatically enrolled to receive up to $3,000 that's put into an account and invested by the treasurer's office. So that's pretty cool. That's a chunk of money. And over those 18 years, those dollars grow. And then at age 18, the baby, who now is no longer a baby, but a young adult, can make a claim on that amount. And that amount then can be used for one of four purposes. One is to use it for higher education. So it could be college, it could be for any kind of training. It could also be used to purchase your first home in Connecticut. It could be put towards a small business or some entrepreneurship activity. And finally, it could be put into a retirement account. Or you could split it amongst those different purposes. So it doesn't have to be put towards one thing. It's also designed to be really flexible. So if you're not ready at 18, you can wait up to age 30 to put those funds to use. And that's pretty much how it works. And again, the birth event has to be covered by Husky. But if the family leaves Husky after that point, that's okay. So you don't have to be on Husky at the time that a claim is made. And it's also not required that you remain in Connecticut, although at the time of making a claim, you have to be a Connecticut resident. So we know a lot of families move around, might go to New York and come back, and that's okay so long as the time of 18 that you're still a Connecticut resident. So that's kind of the nutshell of what baby bonds is and the effect it could have. We do also require that claimants complete a financial literacy course. And we don't quite know what that means. We're still developing the program. But we know that for the families and babies, or the young people, to make the most of the opportunity, we want them to understand what the options and choices are and how to make the best choice for them at that point in their life. So as time goes by, we'll figure that out. So I'll just pause there and see if you have any questions, reactions, and then I'd like to spend a few minutes with you just to think about the families that you all work with and how we can make sure that they are aware of the opportunity, and not just for what it can mean for their family in 18 years, but what are some other supports and services that could be made available today to address certainly the financial challenges that many are having in the moment. So that's sort of where I'll pause there. But any questions, reactions? Oh, are there any raised hands?
I
Go
I
ahead,
have a
Lee.
question. I'm just curious, David, how are families being made aware that they're automatically enrolled in this program? And do they need to somehow acknowledge that in some way, or?
That's a great question. And yeah, so the enrollment happens automatically. So we get the aggregate Husky birth numbers from DSS, and then those numbers then are shared with the bonding commission. And then each summer, the bonding commission will authorize $50 million to be put into this sort of one trust account. And then when the claim is made 18 years later, that child draws from their share of that account based on the year they were born. The challenge, though, has been, and we're still wrestling with this, is that to get individual family information, there are important privacy laws around health, HIPAA and so forth. So the 8,000 plus babies who've been born and are Husky eligible since July 1st, most of them don't know that they are baby bond families. So we are working with partners to figure out if there's a way, like, for example, and I don't want to get too in the weeds. So we're talking with the Connecticut Hospital Association to figure out when the pregnant mom is coming in the front door, before they're assigned a room and they're signing papers and waivers and so forth, is there a box that could be checked there that will allow parental consent to share their information with the treasurer's office so that we can let them know and keep in touch with them also over time that they have this opportunity. So we think, well, that'll get worked out, and once we get it, we'll have to catch up with the families who've already had babies, and then going forward, we'll be able to stay in more steady relationship with them. But that's an excellent question. But it's also a reason that I'm talking with you today, is that when we, and you know this world better than I do, that when you think about the contact that babies and families have outside of their friends and families over the years, there are quite a few touch points along the way that could remind and reinforce the baby bond opportunity. So from prenatal, like to the community health center, the birthing hospitals, to pediatric visits, to programs like WIC and Read With Me and Diaper Bank and family resource centers. As the child is getting older, you can think of multiple touch points along the way. And we think for the families to make the most of this opportunity, that it'll be important to be reminded early and often that this is a thing. Because you think of your own life, like things that happened 18 years ago, or if you're asked to keep track of a piece of paper, or that, I'm eligible for this or that, that's not easy for most of us. So we want to make sure there's a lot of reinforcement about this opportunity, so it's remembered and accessed when eligible. So that's one of the things I want to talk to you all about, is getting your help on how to think about how to best to do that. So Lee, that's a lot of rambling response to your short question, but does that answer it?
It's a start, David.
Yes.
Our agency and a number of the CAPs operate WIC.
Yeah.
I'm just curious, is there a phone number Is there a website? Is there data that or flyers or things that we can distribute through WIC to families that are likely to have fallen within that birth time frame?
Excellent question. And the short answer is not really. So we do have a website of the Office of Treasurer, and we can share that link so that you have that. We do, though, want in the next few months to develop other kinds of materials that can be, whether it's posters or flyers, things with QR codes, etc., that could be shared and made available, and at least in Spanish and English. So actually, one of the things I want to ask you about is, as we develop those, if there are a few of you, all of you, if you'd like, that could help sort of react to and make sure that what we're creating is going to have the effect that we want with the families you serve. That would be really, really helpful. We're also open to your ideas, particularly think about the diaper distribution. Are there other kinds of clever things that we can do to raise awareness that this is a thing that families should be not only aware of but making the most of? So certainly for WIC, we want to figure out what's the basket of materials that we can distribute and make available so that those can be shared with your families.
Thanks, David.
Christine had a question, and then after that, I have one in the chat.
I had a similar question, thanks, around Lee, in connection with Lee, and it sounds like things are still very much in development around how this information is going to be kind of advertised out to families, and if there's going to be language accessibility aside from English. I've specifically found that some of the bus, using the buses to advertise new information especially might be, so I know I just heard you talk about a few different options around flyers and things like that, but I love the idea of using the buses. And since it's their state DOT, maybe you have a connection with that, but it's just a suggestion that it maybe could be considered as well. Because I am worried about that. I didn't know about this, so then we haven't shared any information with our families. And I appreciate, Janet, that you just shared the summary. That's helpful information also.
Thank you. And there was a question in the chat, and then I think someone else had a hand up. Tamara Green asked, what is the income limit if the family does not qualify for Husky?
What is that? I can.
So if they're not Medicaid, is Medicaid the only eligibility requirement? And if not, is income?
Yeah, it's only Medicaid and all forms of Medicaid, and it just has to cover the birth event. So again, when the baby is 2 days old, if that family is able to get private insurance, that's okay. And just so long that birth event is covered by Husky.
And then I saw another hand. No, I think I already lost it.
No, it was Luis Rodriguez had a question.
Yes.
Yeah.
Hi, so, you can hear me?
Yes.
Yeah, sorry for connect late because I have other meeting before that meeting. So my question is it possible you send information about the DAT benefit, because Access in Willimantic have different program and have WIC and diaper bank. So it's good if you can send that information in Spanish and English for share with the participant. It's a great idea.
Thank you. Yeah, and as I mentioned, those materials are still under construction. And before we release them to the world, we'd love to get some feedback from you and others you think could have some good reactions for us on making sure that what we do is right and has the effect that we want. So as soon as we can, but it's going to be probably a couple of months as we're still ironing out some of these other implementation questions.
Okay.
One thing I'll just say is that being the first in the country is really awesome. And we've had calls from a bunch of other states who want to do the same thing. But it also means that we can't call other states to say, hey, how did you do this? Or how did you work through this issue? Because we're first in line. So it's an honor and also a challenge. But so like the state of Maine and state of Washington, California, Wisconsin, Maryland, I think. So a handful of states are really looking to put forward similar kinds of legislation inspired by what we've done in Connecticut. So so we're being responsive as we can, but no, we have a lot of work to do in Connecticut to make sure that providers and families know about this too.
Thank you.
I had a question.
Yes.
Is it enlisting to put in the Access Health website and the Connecticut Gov, like when you apply for SNAP, Cash, or Husky, would that be, or is it in there already information about it? Because we at Junta also like, we help a lot of our clients like do an account and how to apply, how to get your budget sheet. So a lot of people are starting to use it. We're one of them that train the clients. So I think that would be very important to have information. I don't know as a program that you could apply, but at least the information in there.
Yeah, again, there's nothing that parents need to do to apply. It's just really making sure that they are
Okay.
aware of it. And then, figuring out also how the 18-year-old knows that they're eligible. And, we still need to set up the part of the website where a claim could be made. So there's time to figure that out. But the young person will have to verify that their birth was covered by Husky, which sounds easier than it actually is to do that. And then other verifying information so we know it's the right person. And
So
that's a great idea. We hadn't, as much as we talked with DSS about this, we haven't thought to include Baby Bond link on their website, including through Access Health. So that's a really good idea, and we'll definitely.
Yeah, I think that will be very important because when everyone apply or even to get benefit week, everything is in there. And once they get the benefit, they just will see, oh, what's this? Like having just like a fact sheet or something, or do you know about this? If you get accepted for Husky once. So
that's a great idea. Oh, I should mention too that. So sometimes when you get this sort of benefit, it can have an effect on other benefits, but the law was written in a way that, at least for state purposes, this won't be taxed, the investment that you get, nor will it affect any other business benefits that you get. Now, federally though, and we're having conversations with folks in Washington about, is a way to do the same, because it could have effect later on, not now, on benefits. So we just want to make sure that that's known also, because sometimes people can be worried about taking another benefit if it affects housing or something else. So we're paying attention to that too.
David, could I also add just you might want to see how that would impact FAFSA or any of the other type of federal subsidized education grants and things.
Yeah, we've thought about that too. We want to make sure that it's excluded, so it's not considered an asset for financial aid purposes for those who choose to go to college. So it's on our radar and something we're going to try to do something about. It's good point though.
I have a question. Can you elaborate on how this would affect their benefits?
So it has no effect on their benefits.
Oh, okay. I thought you just said that it would at some point affect their benefits. So there isn't an application right now. We just tell them.
Yeah, so it happens automatically. So
okay.
we know who the Husky born babies are, and we just need to make sure the family knows that their baby is eligible based on the date of birth and the Husky coverage, so that they can know what they need to know for the eventual claim to be made.
Okay.
Quick question. So this was made effective January 2022, or are we going back further than that for those Husky families who would be eligible for this opportunity?
So babies born after July 1st of last year, so 2021. So any families who've had a baby born after that and their birth was covered by Husky, they're in. And so you can let them know that and share the website at the very least. And then as time goes by, we'll be in touch with them with more information just to verify that they're enrolled and to let them know about what the effect of this could be on their lives and on their children's lives.
Thank you.
Another idea too, I know that every client and everyone that gets benefits receive, even with their card, their EBT card, if they get SNAP or Husky, they always get this like booklet kind of thing. It's not a lie, it's like a one pager, and it lists all the benefit and all the program that may qualify and everything. That would be a good idea to include that in that form. I think it comes with a card, with a Husky card and or the SNAP or both, I don't know.
That's a great idea. Yeah. Hey, you guys are great. Love these ideas.
I did want to piggyback off of that. My last position, I did work at DSS. I know that they have a department, it's called RPU.
Okay.
And it's like a department inside our department, and they only process newborn insurance. So a lot of what I found when I was a worker was a lot of the clients that used to come in, they weren't aware that their child was already on Husky. So
Yeah.
they would come in and say, oh, I want to sign up and, you know, make sure that my child has Husky, but they already had it. And they don't really know that much about it because they automatically enroll them, because right after they have the baby, someone does come in and signs the baby up. They forward that to DSS, which automatically goes to the RPU division, and they will automatically sign the baby up for Husky. So believe it or not, they really don't know that much about it because the state kind of does it for them. So I do agree with her. And even when they get their medical cards, you know, on the back, those gray cards, you could tell the difference because there's a little icon on the cards that are you can use for like SNAP and use in the grocery store. And the cards that are actually medical cards don't have this little icon on the back of them. But maybe for our newborns who are eligible for this program, maybe we can put on the other side, maybe an additional icon, maybe it says baby bonds or something of that sort. So maybe that can kind of, when we are distributing these new cards, maybe that can kind of strike like, oh, hey, what is this? I know what this is, but I don't know what this is. So maybe, you know, that can be kind of the parents' way of kind of inquiring like, hey, there's this new little thing on this card, on my child's medical card. What does that mean? That's just a suggestion.
Yeah, no, it's great. Love it. Thank you.
Hi, I have a question. Excuse me. So if babies are born after July of 2021, but are not signed up for Husky until this year, will they be eligible?
So just to be clear, so it's not the baby's health status, it's the birth event itself. So that's the mom's birth is covered by Husky. So it doesn't matter whether or not the baby is covered at the time of birth.
So, okay, so the mom has to be covered in order for, you know, the baby to be covered.
Well, the birth events, the baby hasn't been born yet. And, you know, in many cases, the baby would still be covered by Husky after that point. But it's just the birth event itself, and that comes through the mom's coverage.
Okay, I'm so sorry to interrupt again. So the parent has to have Husky, not the baby. So this
Right.
is the parent.
Right, yes.
Okay.
So on a question, does it matter? I know this Husky for like temporarily, I'm not sure about the details about where someone that is undocumented, that they have like temporarily like during their pregnancy, as long as they're covered, doesn't matter what kind of Husky, AB, or they will be eligible, right?
Yeah, all Huskies and documentation doesn't matter.
Okay.
So I'm aware I've gobbled up a lot of your time and you have other agenda items, but I'd love to share the link to our website on baby bonds with you, and also my email address and phone number. So if any of you have any questions at any point, if you have other staff that you'd like to have me talk with, I'm happy to sort of do a virtual roadshow to have a version of this conversation. If okay, I'd love to invite myself back for a future meeting to sort of test drive some of the materials that we're thinking about and just have you react to them. And I hope this is not the last of our interactions. Really, again, appreciate the time.
Excuse me, I'm sorry. I just want to get I didn't get clarification, or maybe I just didn't ask the question correctly. If you have a parent who is not on Husky when they deliver the child, but they sign up for the program like a year later, the child will be born after after July 2021, but they fall on hard times and then apply for Husky. Will they be eligible?
If I follow you, no. So just the birth has to be covered by Husky.
Okay, thank you.
So any last words before we go? Before I go, you have to stay.
Thank you so much for the information. That's great.
Thank you. Thank you very much, David, and for sharing this information. We'd be happy to have you back. Hopefully, you know, I know that there are some folks here who are really interested in offering some feedback on materials, and we'd be happy to have you back to share progress on that. And we're excited about it and what it can mean for the families that these great folks all serve. So thank you so very much.
Great. Thank you guys. Really appreciate it.
Thank you, David. Thank you
All
all.
right. Yeah.
All right. So moving right along, I'll hand it back to Janet to give us a quick update on OEC.
Thank you. Yes, so folks have been anxiously awaiting, and this applies to some of you, but also just additional partners. We are working with OEC to really continue some of the great work that we started during the pandemic, which is offering diapers and other related supplies to families covered by home visiting through the OEC. The contracts, we are still awaiting them. They have yet to be worked through. I have been in touch with the office several times, and our last update is that their hopes is that they can implement a February 1st start date. So that's just informational purposes for members of this group. And some of you may relate to some of the work that you're doing. So we are following up with them. I just wanted to let you all know that we are really actively working on getting that through. So thank you for your patience. Christine.
Janet, if we are an OEC home visited funded program, it seemed complicated, and a diaper bank network partner.
Yeah.
And so I'm hoping that the next iteration will be clearer on like
everybody's part.
Yes, exactly.
Yes, that's very fair. I will say, luckily, fortunately, and unfortunately, we've had time to sort of adjust some of that, given that we're still in the space of the pandemic. So we have actively been working on smoothing some of that workflow, and with Catherine leading that charge, we've already made some really great progress. So great question.
Thank you. So thank you, Janet. Thank you for that. Any other questions on OEC? All right. So moving right along.
Excuse me.
I'm sorry.
I'm sorry, I couldn't find my mute button. I probably should know this already, but I don't. What does OEC stand for?
Sure. Office of Early Childhood. And thank you. I shouldn't have used the acronym, but the Office of Early Childhood.
Okay, thank you.
You're welcome.
Any other questions? All right. So I just wanted to chat real quick about ordering and making order adjustments. So we asked for the orders for the following month to be submitted by the third Friday of the current month. That doesn't mean you have to submit it on that Friday. You could actually submit it before that, right? As long as it meets, that's the deadline. And you know, we have a schedule that we're continuously working. We deliver across the state, and we're really trying to keep it consistent. And in doing so, this is why we ask for orders to be submitted in a timely fashion. So it is really important, and it really relies on the consistency of when the orders are placed. Also, for a variety of safety reasons, we will now only be delivering to the address. We will not be going upstairs. It'll be an outside location. When orders are placed, we will come outside wherever the designated area is and hand it off to whomever the point of contact is for the delivery. And in speaking of that, if your point of contact changes, so for our purposes, you may have someone who handles the program itself, but then you may also have someone who handles receiving the deliveries. If you could specify that when you make your orders, if there's a change, let me know. Email me, Catherine@thediaperbank.org. And so we could update. You could also go into partner base and update your agency's information to those things. So say someone changes, say, the program manager change or anything like that, you could go in there and you could make those updates. In terms of adjustments, we try our best to meet those requests as best as we are able. And we ask for a minimum of 3 business days for changes to directions or points of contact so we could update on our end and be of best service to you, right? So order adjustments and all those things, if you could give us 3 business days, that would be greatly appreciated. 3 business days prior to your delivery. We also have a guide on updating your information in partner base and placing orders. If that is something you would like, feel free to email me and I'll send it to you. I see Lourdes has her hands up. Lourdes, did you have a question? Good morning.
Lourdes, we can't hear you. It looks like you had a question. If you can't do audio, you can type it into the chat and we'd be happy to share it. Let me see. It looks like you're muted. Let me try and unmute you. Let's see. Nope. I think she's having some tech difficulties. If you are able to, Lourdes, type the question in the chat or maybe connect with Catherine afterwards, but we'd be happy to answer your question.
Excuse me, I have another question. Do we need to update, excuse me, update our, or send you our updates every time we get a new person, a new family?
Are you referring to, no, not, that is not in regards to your new family. That is a separate situation. That's the client data. Is that what you're referring to, Tamara?
Yes. Sorry.
Yes, no, I'm referring to deliveries in particular, because I know things are changing and, we're all adjusting to the dynamics of what's happening right now. So we just ask that you give us like a 3 days notice, business days in particular, order adjustments and point of contacts for deliveries, and to let us know if you have a designated outdoor spot for where your delivery will be received. So Lourdes's question is regards to the schedule. So in terms of delivery schedule, is that what you mean, Lourdes? So that is something that we are working on, and in order to do so, we need, a consistent schedule to build that off of. If you have particular days that work best for your agency, please let us know. If you have particular times, please let us know. You can email that information to me, Catherine at thediaperbank.org, or you can indicate it when you submit your order. Does that answer any other questions regarding delivery notifications? And if you have additional questions about that, feel free to reach out after this meeting. So we have an abundance. Okay, yes, Lourdes, we could meet separately and we could catch up if you'd like. Anyone else regarding deliveries and points of contacts, order adjustments?
I have a quick question.
Sure.
Can you just repeat the date that it has to be in by? And I don't know if this is our system, because it possibly can be on my calendar. I will have a specific day and I'm like, okay, this is when I have to have my paper bank orders in, and then my date will change. It'll like cancel out and like send another date. So I don't know if it's like updating or if am I the only one that's having this problem? Because if I am, then it's me.
So maybe we could discuss that one separately. There is a calendar reminder that goes out.
Yeah.
Yes, the calendar reminder. So it's set to go out. We did update that. to be the week prior to the third Friday as a gentle reminder, because it doesn't have to be submitted on the third Friday, but by the third Friday. So just to
Okay.
let everyone know, yes, so that
Yeah,
it's,
so you would prefer for it, my question is, you would prefer for the orders to be in by the second Friday? Because I think that's what happened last month. I was planning on doing it the third, and then it might have been updated, and then I think I put the order in late.
no,
this month.
so for last month, we ran on a different schedule because we were closed during the last week. And we
Oh.
updated the calendar reminder for ordering to be the second Friday, toward that second week. So everyone would know, here you have to order by next week.
Okay, so going forward, Catherine, just to be sure, and on my end, so I can put it in myself, second Friday of every month is when you would like the
No,
deadline.
no, the orders are due by the third Friday. The email reminder we send goes out the week prior to that. So for your purpose, I would suggest the third Friday.
Okay, all right. That's
Any
it.
other questions regarding?
You still can't hear me?
I can hear you.
You can hear me now?
Yes.
Okay. What happened was, remember, I was out for a while, so I didn't do the orders in for January. Mr. Francis did it. And I need that schedule. You know how you have that yearly schedule? What, like you said, you have to order by the third Friday of every month and stuff like that. I'm gonna need that because I like to have it, I keep it up on the wall, and that's how I mark when the diapers, when for me to order, and when they come in and when they don't come in. That's one of my worries, but I can talk to you, Catherine, later on. I'll talk to you. I'll call you sometime today, and I'll explain to you what's going on. Okay.
Absolutely. I'm just noting what your ask is. Absolutely. Yes. Let's schedule some time and review and catch up.
Okay.
And
thank you.
Anyone else? All righty.
Yeah,
Yes, I have a
see-
question.
Sure.
I know we have the new system and where we're putting in clients and everything. So as a child is gradually growing and their diaper sizes are changing, is that something required that we update within the system? Or is the system just basing off when we submit them and that's it? Because I know our orders may change. We might need different size of diapers based on the child growing. Is that reflected on that or no?
No, no, it's not. But we could also review that together because I'd like to see a little more of what you mean.
Okay.
If I
So I'll
might,
reach out to you after and set up maybe a meeting that we can chat about that.
I'm sorry, Janet, you were saying?
no, I was just gonna say, that's a great question. But if you guys are gonna talk about it separately, I think it's just whatever you order. We don't have to update the size and the client level info, probably,
Okay.
but that's a great question.
Okay, thanks.
Yes, I was just wondering if there's something in the database itself that's automatically doing that. So did we answer your concern?
Yeah, it's just that I have a couple of clients who have brought in their pediatrician's letter saying that they have to stick to a certain size, even though they're after age, based on medical conditions, they still need maybe size 6. So we've been doing that internally in our own system, but I don't know if I should have my interns actually doing that within your system, so that it reflects the order that we may request for if we're needing maybe more size 6 for that month. So I was just wondering that.
Okay, no, we do not need that in our system.
Okay.
Thank you.
So the ordering the diapers and submitting the application is still stood the same. Nothing changed from that.
No,
No. Okay.
we will still go over. So, if there's anything that looks different, we'll talk about it when we meet.
Okay.
All righty. So we have an abundant supply of formula. So please order as you need. If for any reason you did not place it while you placed your request while you place your order, feel free to email me and we could adjust it. So we have Similac Advance 36-ounce can. They come 3 in a case. We have Similac Organic 7-ounce can. They come 6 in a case. We have Similac Advance 16 travel packs. They come 2 in a case. And at this time, you can order by the case. So when you go into partner base to place your order, you can indicate that it does not show it as the case, it shows it as the individual amount. So you won't see it as Similac Advanced case, you'll see it as 36-ounce can. So if you order 3, you'll get a case. Does that sound okay? And if you want to, if you've already placed an order and would like to add it, let me know. We'll try our best to facilitate.
Your birds have lots of questions.
You hear them, my coworkers. They're asking about that Similac. Sorry about that, guys. Anyone has questions about the ordering of formula?
Just a quick ask. Can you send that out with the quantities so we know?
Yes,
Or is it
I'm going to
easy?
include that in the notes after this meeting. I'm going to send that as well, so you know.
Okay, thank you.
How many
Anyone
cases?
else?
How
I'm
many
sorry?
How many cases can each family have?
Well, that would be determined by you.
Oh, okay.
I was just sharing that if you'd like to order a case, so each type per case comes in a different quantity. So for the Similac 30-ounce can, 36-ounce can, that comes 3 in a case. 7-ounce can, it comes 6 in a case. So if you had already placed your order for the month and you'd like to order formula and it hasn't been delivered yet, you can email me and we could adjust to include those. Okay. Any other questions? I'm sorry,
Kevin,
Janet.
just one comment on the formula is that we have heard this so much over the pandemic, and we're working so hard to get some extra supplies because we know so many families had trouble. And so this is a partnership with us and Food Share, and we have an emergency supply. We don't know, we have a good quantity, and we just don't know if this will be ongoing, but for now, please feel free to order on behalf of your families. And even if you, as an agency, wanted to just have, some on hand in case of emergency, given how things are still going, please feel free to do that as well. But this is a special program through with us and Food Share.
Thank you, Janet. Any other questions or concerns as we are about to close?
You have one hand up.
Okay, is there a limit? At this time, no. As Janet just shared, if you'd like to order a little extra to keep on hand, no.
I might have seen another hand, but let me see if it went away.
I just have a question, but it's different topic. If I don't know if you're finished.
Yes. No, you're fine. Go right ahead. We're in that section for Q&A.
Yeah, I just have like 2 families that one came from Florida. I don't remember the other one, but there's 2 families that don't have any supply, anything like crib, like baby clothes, like if can I just send an email just in case if you guys, because I know sometimes that you guys will receive, like little clothes or items, just to be aware if anything comes up that we have those 2 families in case. Or do you suggest like somewhere else that I should reach out for baby, like anything for babies?
Where are you located?
New Haven.
New Haven. You can call me at Troop School Family Resource Center. It's 475-220-3000.
Thank you so much.
You're welcome.
Shayla, if you have specific items that you're looking for, we can at least be on the lookout. So sometimes folks will reach out to us to say, I have X, Y, and Z. And so we can definitely either direct them your way or, send them your way.
Great, thank you.
How long is the expiration date on the formulas? Expiration dates on the formulas, how long are they?
That's a good question. I don't have it in front of me. We can double check it to make sure.
Okay. Thank you.
Thank you. Any other questions? All right. So we're about to close out. If you have any additional questions, feel free to email me, Catherine@thediaperbank.org. We would like to thank you again for attending today, your feedback and your continued support, and all that you do to empower communities in need. Please, please stay safe and healthy. Have a great day and a great week. Thank you all.
Can I just
Okay.
give a quick comment real quick? I just want to say also for everyone that Junta received from the city like a supply for the COVID-19 like a home test.
Okay.
So we still, I believe we have like 100 left. We're giving it out to people that really like were exposed or they're feeling symptoms, you know, the appointments are really late. Sometimes it takes like 2 weeks is really, and the walk-in clinic are like those big lines. So if you do have someone or hear about someone, they could call and request it. And we right now have volunteers that are delivering them. They just, you know, no contact, they'll leave it outside, just wait until they'll pick it up. And we also give them masks. So I just wanted to say that we also receive a funding to help out with rent. If I know that Unite CT is helping, but Junta also receive a funding that it could be faster process in case someone undocumented right now, because this came restricted to undocumented for if they owe rent and also help with the utility. I think it's UI bill. So I just wanted to put it out there if you know someone.
Thank you so much for sharing that. Can you send that info out and I could add it to the follow-up email?
Sure.
Thank you
Sure.
so much.
I'll send
All
you
right,
an
everyone.
email.
Yeah, thank you. All right. Thank you, everyone, for being here once again. Please stay safe and healthy and have a great day and week. Thank you all.
Thank you.
Thank you, everybody.
Thank you.
Bye.